Hey everyone, today we're diving into a really important health topic, something that comes up a lot online, but is surrounded by a ton of confusion and bad advice. We're talking about prostatitis and whether self-massage is a good idea. Let's get right into it.
So here's the central question. If you're dealing with the discomfort of prostatitis, you've probably typed this exact question into a search engine. Can I massage my own prostate for relief? It seems like a logical thing to wonder about, but the answer is a lot more complicated than you might think. Okay, let's cut right to the chase. The general medical consensus is a firm no, it is not recommended, and the reasons why are incredibly important. This isn't just a suggestion, it's a serious warning for your own safety. Now look, it's a totally understandable question to ask. You're in pain or uncomfortable, and you're looking for any possible way to feel better, especially something you can do at home. But it is so important that we understand why the medical advice is what it is. So why all the caution? Why are doctors so hesitant to recommend this? Well, it all boils down to some pretty significant and honestly often overlooked risks that come with trying to do this yourself. Let's be really clear about the dangers here. The prostate is a delicate organ. If you don't know exactly what you're doing, you can easily make the inflammation worse, not better. You could cause actual tissue damage, or, and this is a big one, if there's an infection, you could literally spread it. In the worst cases, it could lead to bleeding or even a medical emergency called acute urinary retention, which is when you suddenly and painfully can't pee at all. And check out this quote from the source material because it really brings the danger home. Many people turn a chronic problem into an acute one by massaging incorrectly. Just think about that for a second. You could take a long-term, manageable issue and accidentally trigger a severe, urgent medical crisis. But what about all those how-to videos and special massage tools you see online? Well, the reality is they are incredibly unreliable. It's almost impossible to get the angle, the pressure, and the technique right on your own. Plus, not using perfectly sterile tools can introduce brand new infections. This is really not the place for do-it-yourself experimentation. Now, we need to talk about another critical piece of the puzzle. The term prostatitis isn't just one single thing. It's actually a catch-all term for several different conditions, and the right treatment is completely different depending on which type you have. This chart breaks it down perfectly. If you have acute bacterial prostatitis, massage is absolutely forbidden. The risk is that you could push bacteria into your bloodstream and cause sepsis, which is a life-threatening whole-body infection. For the chronic bacterial kind, it's still very high risk and something only a doctor can even consider. And for the most common type, chronic pelvic pain, massage often does very little and can actually make pain worse by tensing up your muscles. Okay, so I know that was a lot of don't do this. But here's the good news. There are plenty of safe, effective, doctor-approved things you can do at home to manage your symptoms without any of these scary risks. Just look at the comparison here. On one side, you've got self-massage. It's high risk, it can make pain worse, and there's no clear benefit. On the other side, you have safe practices that are proven to relax the pelvic floor, improve blood flow, and provide real relief. It's really no contest. So what are these better options? Things like warm sitz baths are fantastic for soothing muscle tension. Regular ejaculation can help naturally clear the prostate, which is much safer than forcing it. Learning pelvic floor relaxation techniques, and I stress relaxation, not strengthening, can be a game changer. And finally, just avoiding things that irritate the prostate, like sitting for too long or eating spicy foods, can make a huge difference. All right, let's bring it all together into a final, simple rule of thumb. This is what you can use to make a safe decision for yourself. So you're thinking, okay, I've got all this info, but how do I actually know what to do in my specific situation? Fair question. Let's make it easy. Here it is, your absolute safety checklist. If even one of these points is true for you, if you have any current pain, swelling, or fever, if your urinary symptoms are getting worse, if you've ever had bacterial prostatitis in the past, if you have no idea what type you have, or if you're planning to follow an online video or use some tool you bought, the answer is a simple, clear no. Do not attempt to massage your prostate. And if you remember only one thing from this whole discussion, let it be this. Having prostatitis does not automatically mean you need to be massaging your prostate. For most people, the risks are just too high and the benefits are just not there. Which leaves us with a final, really important question to think about. When it comes to something as serious as your health, where are you going to place your trust? In random advice you find online? Or in a medical professional who can give you a real diagnosis and a safe plan to get better? The choice really matters. Thanks so much for joining me.